everybody. We are presenting our public health campaign on malaria. And before we get started, I want everybody to imagine that they're a 10-year-old boy living in Nigeria. Young, healthy, athletic, good in school, many friends, and one Saturday afternoon, you decide to help your dad on his farm. Unfortunately, 1 week later, you become extremely sick. You have no idea what is wrong. Your parents decide to try herbal home remedies, but they do not work. Though you were not feeling up to par, you decide to push through the sickness anyway and continue your day-to-day life, until one day you couldn't take the pain anymore and decide to go to the hospital. Once at the hospital, you discover that you have a severe case of malaria. However, it is too late. The sickness worsens and you become brain damaged and can't continue life as it was before. Learning became harder. You weren't strong enough to continue the sports you loved, and you did not have energy to go out with your friends anymore. Unfortunately, this is the story of many people in Nigeria. Malaria is an ongoing and deadly disease that takes thousands of lives. We hope that through our campaign that we can bring awareness to this pressing issue. Our goal is to inform and bring awareness to the citizens of Bauchi State, Nigeria.
This is our team. So Anissa worked as the project manager, Anik worked as the solutions expert, Taylor was the finance manager, Julianne was the advantages analyst, and I, Carson, was the expert in disadvantages.
Malaria is a huge problem in many developing countries around the world, and Nigeria is only one of them. Nigeria consists of close to 200 million people, and malaria affects 97% of this population. Among HIV, AIDS, respiratory illnesses, meningitis, and many other diseases, malaria is the fourth leading cause of death. Most of the population is susceptible to getting this disease because of how poor they are, along with the fact that they live in rural areas where they are unable to learn about this disease. Most are unaware of the many accessible treatments and resources that exist in Nigeria. There are so many resources put in place, yet malaria is still such an outstanding problem. This is not okay and should not be happening. Now onto the SWOT analysis of the current situation in Nigeria. A strength that exists is that there are a lot of resources and infrastructure already in place. No new treatments need to be created, but rather they need to become known to the public. We have the opportunity to open people's eyes to information they have never had access to. It will shine a new light in their lives and hopefully increase their quality of life by knowing of these treatments. Although there are some new opportunities that will arise, a large weakness is that only 5% of the government's budget goes to the healthcare system. How can these people receive adequate knowledge and treatment for their illnesses if there is no money or support for it? Along with a small government budget, the biggest threat is that many in Nigeria are desensitized towards the hardship and disease that devastates their country. The poverty that the country experiences and the many diseases that plague the country is all that they know, and that is their normal. They don't know that that is not how it's supposed to be. A solution is needed for this tremendous problem.
So we came up with the solution. Our solution is to distribute infographic posters in order to spread awareness to parents and young adults about malaria. And it has three elements to it. The infographic will focus on when they should seek this malaria treatment, because there's many patients that just don't seek the treatment they need until it's just too late. They'll be stuck with brain damage or something really bad, and it could have been prevented if they just seek treatment at the right time. Another thing we're focusing on in our infographic is options if access to these treatments are unaffordable or inaccessible. And we're also focusing on nearby places to seek these treatments in the Bauchi State area.
These are our two infographics. The first infographic focuses on when someone should go to the hospital. We listed symptoms to malaria so that if you are experiencing these symptoms, we basically state that you should go to the hospital. We also put an option in there that if you can't afford to go to the hospital, there are some remedies that can help calm the symptoms. The second infographic focuses on the alternative treatments specifically. So we put 3 different options that they could seek, but we wanted to expressively say that you definitely need to go see a doctor because malaria is deadly. And we are going to distribute these in areas where a lot of people will see them, especially adults.
All right, so we came up with a 6-step plan to implement our solution. Step 1 is going to be designing the infographic. And then step 2 is printing the infographic, which in collaboration with the ally staff we will in Nigeria we will be doing. Step 3 would be distributing these posters at Wunti Market and Federal Polytechnic Institute in Bauchi State. Step 4 would be monitoring the effectiveness of our infographics. Ways we could monitor the effectiveness could be seeing how many people are seeking treatment after seeing these posters, and if the at-home remedies are being used for those people who can't afford these treatments. Step 5 would be improving if necessary. If we feel that there's a vital piece of information that's missing, or if there's a better place we could put these infographic posters, those are things that we want to keep in mind and definitely improve. Step 6, at leadership initiatives, our ultimate goal is to save lives. And we really hope that by spreading awareness about malaria and presenting them with this infographic, we can really do that.
Some of the advantages to our solution is that it first informs and reinforces. Our posters inform parents of treatment options, whether it's going to the hospital or using the home remedies. It provides families with where they should seek treatment, so the hospitals is the main place. We also wanted to enforce the significance of malaria by stating that it is deadly and you do need to seek treatment before it gets too bad that they can't fix it. It is also very cost efficient. Since we will be printing within Bauchi State, we only have to focus our funding into printing. We don't need to transport anything. And with such a low price, we will be able to reach so many people. There are also opportunities within that will help our solution. For example, COVID-19 is causing people to pay attention to healthcare in general, including malaria treatments. There are many clinics and hospitals where people can receive treatment within Bauchi State. And there are organizations, including the WHO and the US President's Malaria Initiative, that are providing free treatment to people who come down with malaria.
So the first disadvantage to our solution is literacy rate in Bauchi State. So the literacy rate in Bauchi State for English for adults is 26.6%. However, hopefully these posters will be translated, or they will be translated by the LIA staff in Nigeria. And the literacy rate for any language in Bauchi State is 65.7% for adults. So we are hoping this will be reaching many people in Nigeria, but that still leaves 35% of Bauchi State's population without the ability to read our posters. The second disadvantage is accessibility, because we are only spreading these posters to 2 different locations outside Bauchi City. We hope that this means we will be able to reach more people, because in the sense that those people in those areas, it's heavily populated and we will have a lot of posters to reach all those people. However, the rest of Bauchi State will not have access to those posters. And the final disadvantage to our public health campaign is interest, because people who do not have malaria and are not exhibiting symptoms may not take the time to look at our posters and therefore will not receive information for the future if they do develop malaria.
For funding, we are requesting $200 to print and distribute our infographics. $200 will help us print 5,000 posters. $205,000 will go to the Wunti Market, which is in the heart of Nigeria, and it will get a lot of exposure, and a lot of people will be talking about it because it's at a public place where a lot of people are. And the other $2,500 will go to the Federal Polytechnic Institute, which is a school that a lot of prestigious and responsible students attend. So we are expecting that they take this information home and tell their families and tell their friends and spread awareness. To conclude, I want to reiterate that our goal is to inform and bring awareness to available treatments in malaria. As I said previously, we are requesting $200 to print 5,000 posters to distribute and hopefully bring awareness to this issue and save lives. If you have any further questions, please email one of us. As I put on the screen, we have our emails there. And again, thank you for listening.
Fantastic job, everybody. So give us 1 second. We're going to bring in our amazing judges to review your presentations. Okay, moving them to panelists right now. Okay. And the first judge we're going to have reviewing you is Dr. Aisha Garba, a medical doctor in the country of Nigeria. Dr. Garba, would you like to go first?
Yeah, I don't mind. So thank you very much for the presentation. Trust me, it was amazing. Wonderful, wonderful, really, guys. This was really, really good, okay? I liked how all of you, the confidence, the body language, the diction, everything was perfect. You know, your plan was good, everything was good, only for one thing. So those people who you want to, you said aren't going to read your posters because they might or might not have malaria and they're not going to see it. Do you, it doesn't have to be here, but do you have any plans for them? Because, you know, it's a way of trying to prevent this malaria. You don't have to answer this now, but maybe in the future, you'll think of those who have malaria that are asymptomatic, and you want to also create awareness to show them how they can prevent that from happening. All right? Thank you. Otherwise, it was amazing. Okay? Thank you.
Thank you. And next we have Nancy Allen, the Executive Director for the National Consortium for Health Science Education. Just so everyone understands what it does, they are a nonprofit that represents all 50 states and US territories in, I just want to make sure I get this right, Nancy,
Okay.
health science at the state leader level. So this is high school, secondary, post-secondary, and adult career training. Am I accurate?
Very good.
Okay, so guys, she's in charge of the entire United States as far as.
Oh, right.
So
Okay.
a national leader,
Yeah.
Nancy Allen, will be giving her review of you.
Okay. Thank you, Marshall. I thought very creative, especially that initial hook when we were to imagine ourselves as a 10-year-old, I think, with malaria. So thought that was a nice way to get the audience on board and engaged at the beginning. I like the way they shared their goals. I could tell that they had done a lot of research to support their presentation. It was conversational, so it was, you could tell that they were not nervous, but as the doctor shared, they were confident. And I think the confidence comes from the preparation that they had done. So I thought it was realistic when they mentioned all about the literacy levels and the translations that would have to occur. I like the way that they were planned to monitor the effectiveness of their program. So congratulations, young people. You did a great job.
Perfect. And then, guys, my thoughts on your presentation were, you were honest. And sometimes the hardest thing about these presentations is that it's too good to be true. And you guys really showcased the pros and cons of your what you wanted to accomplish in a way that reassured me that you weren't overstepping your goals or what you could achieve, but had a realistic solution, in that the people whose lives you want to change came first. And that was incredibly clear throughout the entire presentation. So thank you very, very much for your dedication here. If we were in person, I'd have everyone give you a round of applause. You did fantastic. College admissions officers, if you want to know more about any one of these students, the information to contact us is at the bottom of this YouTube video, at the end of the YouTube video, and links to each student's personal website. So you can actually see them diagnosing a patient in northern Nigeria and saving a life is connected to their student websites at the bottom of this YouTube video. If any questions about any of these students, please contact us at Leadership Initiatives.